My name is Ramon Diaz-Arrastia. I'm a neurologist at the University of Pennsylvania. And Kevin and the Quanterix team asked me to welcome all you to the Power and Precision Health Summit. This is the fourth such summit. I haven't been to all four of them, but they're all very innovative, very high-level discussion, really spans across different fields. So I think you're in for quite a treat.
My name is Tatiana Plavinia, and I'm leading clinical biomarker strategy here at Quanterix. Some of you may know me through Biogen, where I've been for quite a few years working on biomarkers, and really excited to be here in this role. So again, thank you so much for coming here, and really looking forward to this day of all the new hot-off-the-press research. For those who come to share it with us, but also those who came to learn about biomarkers, biomarker technologies, and what they can do to improve people's health. I've been in this forum for a couple times before as a part of, again, as a Simoa customer, and really enjoyed and energized by this interaction. And now I think I'm more than ever excited about this opportunity in front of us of discovering new biomarkers, but also translating those most promising biomarkers into clinically relevant tools and driving this precision medicine and, more importantly, precision health initiative. So really looking forward to this day together with you and to learn all that many things.
And last but not least, I'm Andy Nixon from Duke University, and I represent the oncology franchise. This is my first PPH, and I've recently been named one of the advisory members for the advisory council here with PPH. I set up my lab maybe 12, 15 years ago and termed it the Phase 1 Biomarker Laboratory. And at that time, I recognized the liquid biopsy was the wave of the future. Anything that I could develop in the blood could easily be translated and help cancer patients. We're a little farther along in cancer than we are in neuro with regards to biomarkers due to the diversity. But I think a lot of the lessons learned and a lot of the technologies that we've employed here, including technologies like Simoa, are really helping to advance. And as we heard last night, we're really trying to improve patients' lives. And through better technology and better biomarkers, we can hope to do that. So with that, I look forward to an amazing day, and I welcome Kevin to the stage to kick off the fourth PPH Summit. Thank you very much.
Good morning. How's everybody? Is there some energy in the room here? So I have to say, thank you for that introduction, Ramon, Andy, and Tatiana. This is an amazing moment for biomarkers in the world, and we think that this forum has continued to evolve very productively it's actually the fifth Power and Precision Health, so we're really excited that this one is by far, we think, the most energetic that we've seen around the attendance. Even though it's probably going to be a little bit crowded in the rooms, I think there is a second room right now where they are actually watching from that room, and there's going to be a lot of coordination between the rooms. So let me start off today by just welcoming you to Power and Precision Health. Our vision is basically early detection and also looking at initially treatments, because we believe treatments of people that have disease is where most of the money resides today. Most of the drug companies put a lot of money into trying to cure people. So we believe that obviously treatments is a great place to have early detection, because the earlier you can detect and the lower the dose of the drug, the more effective and the less toxic it can be. So we think that there's profound opportunities in treatments, but we also believe that longer term there's profound opportunities in the prevention of disease using biomarkers, but there's no profit today in prevention, so there's not as much focus on that area. But we think the future is going to be so exciting relative to preventing disease that we think that that is actually going to be more important than treatments. We have this slide that we've shown historically that just shows the life expectancy across different countries, opposite how much money is being expended per person per capita. And what you see is that there are certain countries of the world like Japan and France where there's very productive living going on, and they're doing it for very low amount of money per person, which is almost defying the odds. And America is actually way off the map. It's not even able to be put on this map. And so a lot of our goal is to how can we migrate these countries that are way off the map into much better economics with much better productive lives. And we also believe that those countries like France and Japan can continue to make their evolutions. And what they've been able to do is they've put a lot of focus on prevention. So interestingly, these countries are so focused on eliminating the environmental factors that are creating the diseases that they've already changed the whole economic paradigm of how healthcare can be practiced, where United States is a major mess. So what we'd like to do in this overall Powering Precision Health is talk about how disruption can really change the world. And we've watched how Steve Jobs with the iPhone has created so much disruption. And these companies that you see on this slide are what we call the $1 billion club. And so there's a lot of investors that actually are really diving on technologies. And you can see that in the last 10 years, there's so many companies that become $1 billion in valuation so rapidly because of the speed of software and the digital transformation. So in the area of where biomarkers play, the convergence of this technology with healthcare is a lot of what we're trying to inspire with Powering Precision Health. And the whole concept of seeing disease late with very invasive procedures is really the paradigm that we think we can shift into seeing things very early with non-invasive procedures. And that's the whole focus of the digital transformation, and to see these abnormalities very early in the overall disease continuum. And then ultimately to stop the disease triggers that are actually creating these diseases. We actually think it takes a movement. Someone said that technology itself seems like it's all you need, but the problem is there's so many great inventions that never make it to patients. So the real challenge when we are trying to evolve biomarkers is how do you get the regulators? How do you get the payers? How do you get the larger ecosystem behind it so that in our lifetime it can have an impact on patients as opposed to the traditional 10 to 20 years of just trying to break through the regulatory barriers. And so we're trying to find creative ways through collaboration in the meetings like this to see if we can accelerate this so that patients can get the benefit. And we think it does take a movement. And today we're going to have 42 speakers presenting across 2 different tracks. Last year in Amsterdam, we had 18 different talks. We had less than 100 people. Today, I think they're saying now it could be as many as 300. There were a lot of walk-ins that occurred toward the end of this, so we didn't expect this level. We're very excited about that. And I would also say that it used to be that we had myself and a few people from Quanterix kind of drove the agenda and drove Powering Precision Health. We did form a board this past year, and you can see the board members on this slide, and we want to thank you very much for all of the help that you're providing to make sure we continue to expand Powering Precision Health across the entire industry. We don't want this to be simply a Quanterix type of event. In fact, we spun it out of Quanterix. It's a nonprofit now, and many of the sponsors that you're going to see in a moment that are funding this are funding it mainly because it is a nonprofit. So we really want this not to be a Quanterix forum. This is a broader forum where we're trying to invite and solicit technologies from around the world that we can put through the regulatory and through the paying groups and see how we can advance this overall agenda. There's huge challenges in healthcare today. The regulatory reimbursement, these archaic medical records probably are one of the biggest issues that we have around the world. Trials and pipelines can cost $1 billion, $1.5 billion to get these drugs approved. So failures of drugs is clearly significantly more prominent than successes. And we also know that there's so much risk in what you do with innovation that it's important that we have investors also behind us. And so today you're going to see we have some of the largest investors in the world here, and they're actually listening very carefully to all the things that are going on so that they themselves can go back into their funds. One of the funds is over $1 trillion fund that they could go back and make investments for the long term to help make sure that these biomarkers make it. And as we said earlier, there's no profit in prevention, and so long-term focus is key to this. Now, you might remember when we first started Powering Precision Health, I came out dressed as Steve Jobs, and I actually had a slide of Elizabeth Holmes. I still to this day believe that her vision of what she was trying to achieve was remarkable. The challenge was the ability to execute against it, right? So technology was probably one of the big problems that they had, and today we're going to further pursue this. But it's important to understand that when we try to inspire belief systems around things that have never been done, it's very easy to cross the line of fraudulent behavior. And that's what we were very concerned about. There was a lot of question whether biomarkers could even make it given what happened with Theranos. But the reality is that it's almost worked to everyone's advantage, because now third-party peer-reviewed pubs collaborating with all the scientists around the world is really what we're doing with Powering Precision Health, and it's almost creating a whole new paradigm of what we call clinical validation. And that's what's key here is that it takes a village to pull this off. You can't do this with a lot of trade secret. You really do need to collaborate. And that's the key to advancing these technologies very rapidly. And you can see there's over 2,000 peer-reviewed publications represented by the speakers here today. And we have a lot of what we'll call advances that are going to be presented today as well. Here's some of the speakers. This is what makes our meeting, are these speakers, and they're bringing a lot of new information and insights and perspectives that each of you, when you see them, might trigger some new idea that you have in your laboratory to try to advance your science and to come up with new creative concepts that might advance biomarker research overall. This is where some of the keynote speakers are coming from, and this is the types of people that we have at this meeting. It's not just what we'll call innovators that are working on the therapies. It's also academia, providers. We get a lot of patient advocacy groups as well as investors. And this is the percent of the overall population that's helping us move from innovation to the patient. We also have these sponsors, and it used to be that Quanterix was the 100% sponsor, and now they're probably about 30%. So our largest other sponsor this year is Abbott. I really want to give them a lot of accolades. This is their first time for sponsoring, and it's a major sponsorship that they've provided, which allows us all to be here without any expense to you personally. So these sponsors really appreciate it. There's a lot of folks here, too, from Quanterix. Those with the asterisks are the folks that actually have put this program together. We want to thank them for their amazing skills of trying to assemble everyone together so productively. So what I'd like to do now is talk a little bit about environmental disease triggers. And we've talked in the past about how if you're born today in the United States, your life expectancy is actually shorter than your parents, which is hard to believe. It's hard to believe, but it's true. And we also have been watching the population around the world. And if you look at how long Earth's been here and you put it on an annual basis, a one-year basis, humans came onto Earth on December 31st, on the 23rd, 1 minute before the end of that year is when humans came onto this Earth. So they haven't been here very long. And when John F. Kennedy was inaugurated, I think our population of the world was around 1 billion, and now we're heading for 8 billion. So the world's population is exploding over the last 20 years, and it's continuing to advance at a pace that is creating a lot of pressure on how we resource all of these humans around the world, which puts a lot of pressure on so many aspects of the environment as we continue to try to resource and make it possible for so many people in this world to survive productively. And you can see by 2035 globally, the expectations is that cancer, diabetes, over 1 billion people will have diabetes by 2035 in this world. That's as many people as we had in this world back in the early 1940s and 50s. So it's amazing to think what's happening to many of these diseases and environmental factors. And one of the things we've looked at for years is it's interesting that the United States is consuming so much sugar compared to anywhere else in the world. And when they do that, they're also consuming so much more energy. So we're also wondering if the reverse correlation between life expectancy and sugar consumption and energy, meaning that we're probably not riding our bicycles, we're probably doing a lot of things that are not healthy, creating pollution. And the overweight factor for United States is part of what we like to look at United States as being a test case for how we can maybe make some advances. This is a slide that I think it's going to start to show you population around the world in obesity. Just in the last, let's say, 35 years, you can watch as it gets dark, it talks about people being overweight and obesity. And it's amazing, it isn't just United States, but clearly you can see the intense red of United States. And this is a factor that it's amazing to me how little people seem to understand how severe this issue has become around the world. So I think we're up to 2012 now, and you can see it's continuing to advance, unfortunately. I think this stops at 2014. This was United States in 1994, and just 10 years later, you can see what's happened to the United States. It's just amazing to think how much obesity has occurred so rapidly. And we now know that there's so much connectivity between our diet and obesity with cancers. Many of the folks in this room have done a lot of epigenetic studies, and we can see so many linkages around being overweight to many key, components of cancer. In the UK, as well, they're showing that 40% of cancers are avoidable. And the closer we can get to our biochemical understanding at a biomarker baseline level and annually track that, the closer we're going to have to being able to manage and empower our own health destiny. And that's a lot of what we think ultimately biomarkers are going to be able to do, is we're going to change the name of this at some point from powering precision health to empowering personalized precision health, because we think everyone someday are going to be able to track their biomarkers and understand movements from baseline, and those movements will be the earliest indications of disease evolution. So yes, let's talk a little bit about addiction. There's liking, there's wanting, and then there's needing. And the food industry has been incredible at actually using science to figure out when serotonin and dopamine releases occur. They call it the Bliss Point. I was actually in the food industry at one time and watched them actually come up with a formula of fat, salt, and sugar that would be the Bliss Point that you couldn't stop eating it. And then we were so proud that we would even show commercials that you can't just eat one. Well, come on. You know, now we look at this and we realize, what are we doing? And we look to the right, and we've had many engineers from Google and others stand up and tell us that they're creating addiction for children on the iPhone right now. Kids are running around trying to figure out how popular they are. Are they actually interfacing with all of their friends every 24 hours? They're doing everything they can to create addictions. It looks and feels so similar to me to what I saw with the food industry back 20 years ago with the iPhone. And we know there's sleep disorders and a lot of things that are starting to show up. So could we be seeing the next wave of environmental factor, even in the thing that we all love, the iPhone? Subsidies is another key thing that it's interesting. We do have some politicians that have been linking into powering precision health. And in the United States, there's subsidies that almost make sugarcane and corn free ingredients for the food industry, which then leads to a lot of the corn syrup that's all over the place throughout almost all the processed foods. 160 pounds per person per year of these sugars, and we're also applying them and feeding them into chickens, cows, and salmon. And what we end up with is using pesticides and growth hormones. We're actually milking cows as many as 3 times a day. We know there's tremendous linkages between many of these growth hormones and breast cancer. We can see already diet and a lot of the antibiotics now that are going into animals could be destroying the microbiome, triggering a lot of other types of diseases. And so there's so many componentry just in what we eat, in the way we're subsidizing all of this production for the profitability of the food industry. And a lot of that is leading to these diseases you see on the right with the overloading of our insulin and our hormone imbalances. So, you know, this is just the food part of this story, but we also know that there's profitability in a lot of sports, right? And so you have a lot of concussions we know today around the world just from athletics, and we're now seeing a lot of evidence of the linkages between concussions and many of the other diseases. So environmental factors are not just in the food, they're not just iPhones. Across so many different categories, we think that there's environmental factors that we think that biomarkers are going to provide a tremendous opportunity to measure. So now moving into measuring life's variables, on the left-hand side, I love the identical twin studies where they're born with a very similar genomics, and then one of the twins grows up to get cancer, the other twin grows up to get heart disease or diabetes, and a lot of it has to do with the environmental factors that are shown on the left-hand side. And on the right, we've always gotten so fascinated in the investor world, and I spent 10 years of my life with DNA, making DNA libraries. No doubt it's a big piece of the equation, obviously going into RNA, but the protein ends up, we think, having so much more phenotypic power. And so the whole concept of coming up with analytical technologies to really interrogate the protein is a lot of what we think the future of biomarkers is about, and combining that then with the other omics on the right-hand side, we think is going to lead to the best opportunity for us to measure life's variables. So this whole concept of early detection, we know that the probability of a cure goes down as you get a disease discovered later and later. And we also know that the cost of advancing someone that's got very late stage disease is very expensive. Most of the cancer drug industry today is trying to extend life 6 months. If we could just put 1/10 of the investment that we've put into trying to extend life 6 months into early detection and seeing the cancer cell when it first metabolizes and when it first becomes part of the body, we would probably be so much further advanced. But we are making a lot of progress, extending life 6 months at a time. But a lot of that money investing is going to start to shift forward because of what we call preventative health care, being able to see these diseases much earlier and actually to move into prevention at some point. So our focus has been primarily on cancer and neuro, thinking that those are the two areas where disease is discovered the latest and it seems to be most lethal. And I'm proud to say that there's now 160 publications in cancer utilizing the Simoa-type technologies on proteins, and there's now 315 on neuro. So it is almost advancing a publication a day now in neuro, which is just unbelievable to understand the impact. And again, the blue represents sensitivity. Being able to get earlier detection less invasively is the key to, we think, the future of this biomarker revolution. Now, Quanterix, at least as one of the leading sponsors, now has 3 different platforms that are very viable and productive. The HDX was just launched, the SRX was launched last year, and the SPX was launched this year. And these are the technologies that most of the room and most of the publications that we're talking about today are demonstrating by. And I did want to show you, too, that we are using publications as the fuel for the Quanterix company. We actually believe that the more third-party peer-reviewed pubs, the more people then understand and see the possibilities of how these technologies can work, which leads into more biomarkers. And we've actually encouraged biomarker development through homebrew. We actually want our customers to come up with their own biomarkers and their own assessments, and so we provide kits that will allow those homebrew opportunities to manifest. And I think, Henrik, it was NFL was a homebrew back about 2.5 years ago, and it's like 1/3 of the Quanterix company right now. So homebrew is a great feeder to help us advance the company. And I did want to let you know, we went public a couple years ago. We've raised over $160 million toward biomarkers. And so I know when Elizabeth Holmes was doing this at Theranos, it was a private company. Today we're going to interrogate this a little bit because we do have investors also that we think it's important to continue to fuel the validation of what we believe now is a real possibility to transform healthcare with biomarkers. So we're taking every step we can to swing for the fence to enable the opportunity for biomarkers to get invested in a way that brings them to patients in our lifetime. So we're moving very rapidly across every front within Quanterix as well as through PPH. This is just to show you the drug industry itself ends up being one of the top environmental factors. The 4th leading cause of death in the United States are adverse effects to drugs. And so toxicity of drugs is actually one of the most dangerous and one of the most proliferating concepts that's so challenging. You just watch commercials on TV and they show for like a couple minutes, couple seconds what the good thing is, and then for the next 90% of the commercial, they describe all the bad things that can happen if you take the drug. So we know that drugs have a lot of toxicity, and we also know that they're not always efficacious. In fact, in cancer, only about 25% of the time. There is a lot of evidence now from the pharmaceutical industry itself that if they use biomarkers, they can increase the probability of getting drugs that are less toxic and more efficacious to market. A phase 1 trial, if it's successful, if biomarkers are used for the phase 3 trial, there's a 300% increase in the probability that that drug is going to be approved. So the FDA is now getting behind biomarkers in a very productive way, particularly if you can measure disease progress without using symptoms. If you can get way early in the disease and understand what that disease is doing via biomarkers long before symptoms, you have a much better chance of impacting it. So the FDA has looked at the neurology landscape and has said there are no real good biomarkers to help us understand brain health. And there's an $800 billion challenge right now just in the United States alone around neuro diseases and trying to find drugs for them. There's never been an Alzheimer's drug approved, and we've been watching Biogen very carefully. They lost $18 billion evaluation in one day about 3 months ago, and they've recaptured about $10 billion of that by re-announcing that they do think there's now a shot with earlier and higher dose of using some of the newer agents that they have. So we're pretty excited about the progress, and we know the FDA is really trying to advance this. These are the companies that are now deploying biomarkers, and we see that this is expanding every day, and it's a big piece of the future. NFL is one area that we really have watched advances. There's 46 active trials right now for neurohealth and looking at neuronal health, and the focus is across almost every category of neurodegeneration. This was the recent ECTRIMS, and there were some pretty profound things presented there from Novartis, as well as Roche and Biogen, many of the academics in this room, advancing for MS using NFL as a really great blood non-invasive disease progression marker. We actually teamed up. It was actually Nicholas sat in this room last year in Amsterdam. He was the founder of Uman, and Uman now is part of Quanterix. A lot of it was because of what happened in last year's Amsterdam Precision Health Summit. It was such an exciting moment to see just how advanced NFL is, and 100% of the current publications are based on Uman's antibody pairs for NFL. And this was profound, and we actually looked for 3 years for alternatives to Uman's antibody pairs, and we couldn't find them. For 3 years we tried. So this is an example where we felt it was in everyone's best interest to combine and team up, and we're now working diligently to move that, even through Siemens. I think they're in this meeting. They're now been given a license to utilize the Uman pair. We've also done it with Biotechny. So across the board, we're trying to advance and move that NFL antibody pairs around the industry. This is a slide that Tatiana helped me build, but with Simoa and Uman on the left-hand side measuring, we now have got all these different categories that we're advancing with NFL. And then on the right-hand side, you can see that we're using this as a tool for clinical decisions as well as drug development. There's a major trial getting ready to start in January. Jens and David Leppard are in the room where we're looking at normalcy, as many as 11,000 samples from age 7 to age 70 to watch what happens with your NFL level just based on age. And so this is a pretty profound opportunity, and the FDA is watching very closely. We know that there's today $22 billion of MS drugs, 15 different drugs. When do they work? When don't they work? And a lot of the NFL is now beginning to indicate for folks with MS when it is that the drug is working. And the goal here is, can we keep people out of wheelchairs when they die with MS? And I think that's the key, is to get them on the right drug much quicker. It could take as long as 2.5 years using MRI to understand whether there's brain atrophy as a result of MS. And so a lot of the advances here is to see very quickly through blood, non-invasively, whether the drug is having the appropriate benefit. And you're going to hear a lot more from Jens and David Leppard around the advances that they're making in the overall flow diagram for utilizing the NFL for this technology for MS disease progression. Alzheimer's is another one that's pretty exciting. There was a major study about a year ago where 16 years before dementia, they were able to see elevation of NFL levels in familial Alzheimer patients. And so this was a profound opportunity to see very early stage Alzheimer's, and we think that, again, that's going to help with cohort recruitment for many of the trials. And you can see now on the right-hand side all the different biomarkers that we have in the neurology landscape across all these different disease categories. So it's a pretty significant advance that we think is leading to the right outcomes. We're now moving aggressively into cancer. You're going to hear a lot of our track today around cancer, but picking the right drug for the right cancer. And also, we are well aware that there's a cytokine storm and release syndrome for many of the immunotherapies, and can we get to those much sooner before the patient gets put at risk? These immunotherapies are only working about 10% of the time, and 10% of the time they're creating cytokine storm. 80% of the time they're having no benefit. So 90% of the time there's really no benefit to the patient for a very large economic. It could be as much as $2 million per year per patient for these immunotherapies. And so if we can figure out after just one treatment versus, say, 11 treatments to see if the tumor shrinks. It takes almost 6 months to look at this via imaging. If we can get there very quickly and know right away whether there's a release or whether the drug is going to be effective, we can change the economics of immunotherapy and have a much more profound effect. So in summary, when we look at this overall market, we're continuing to see tremendous opportunities for biomarkers. We think it's a category-defining opportunity for changing the way healthcare is practiced to become preventative versus treating the sick. We think if we can get upstream and start to see these diseases earlier, there's a massive opportunity. We think it's something like $40 billion alone just in reinventing the diagnostic industry. We know Roche, Siemens, and Abbott today are a big componentry of this, and it's great to see all three of them at this meeting. We see their sponsorship. They're very much focused on how do we deploy these earlier ways to see disease, and point of care will be the next major area of focus. Pharmaceuticals, top 19 of the top 20 are now using biomarkers and validating its technology, and there's a fairly significant opportunity through these publications, over 600 of them now, to keep advancing this. So in closing, I would just say that this meeting is a lot about debate and collaboration. The way we can advance the agenda is to debate and to provoke each other into what it is that we think are the answers, and to collaborate and to thoughtfully think through what this means. The first Power and Precision Health Summit we had Bob Weinberg and a scientific founder from Quanterix debating breast cancer and whether the biomarkers of today and the mammogram of today is productive or non-productive, and the chemistries and the agents that are being deployed against breast cancer based on a lot of calcification in the mammogram and the level of false positives. I think 50% of people that have a mammogram will have a false positive over a 7-year period. That's a massive level of false positive that leads to weeks and weeks of anxiety for anyone that has that false positive in a mammogram, which then leads to 99.9% of those people that have those false positives ends up finding out they don't have an issue. But they're being radiated numerous times in order to even get that answer. And that radiation from all those mammograms could actually be triggering some of the cancers. And so we know that there's a lot of opportunity here. And at that first Power and Precision Health, there was a major, massive argument that broke out on the stage regarding the mammogram and regarding its use and its benefit and where we go with all of these agents for breast cancer. And the folks that were in the audience wrote to us saying it was one of the greatest things they've ever seen was to see that massive debate, almost a fight, break out on the stage. And so from that moment, we said that that was healthy. It's a healthy for all of us to provoke everyone else's ideas and see what their view is. All of us come to this world with a whole lot of different experiences. We all have different paradigms. I asked that some of the leaders in the world are at this meeting. This is an opportunity for us to not only debate, but then to figure out new pathways of collaboration. We've seen some of the most amazing collaborations stem from Power and Precision Health Summits. So we're trying to create as much opportunity for you to mix around and see each other, get to know. I would ask you, just if you see someone, just reach out, introduce yourself, make sure you know where they're coming from, because what we're learning is that those that focus on the brain versus those that focus on oncology, there's a lot of similarities. We know that brain cancer is one place where it really comes together, but we also know that biomarkers in general, we think of it similar to looking down on Earth and seeing all these islands. If you were to lower the water level, you would see that all those islands are connected. We actually think biomarkers are the key in the human body to connect many of the different disease categories. And then the more we can understand the baseline understanding of all of our proteins and then movements from those baselines, the better chance we have of ultimately progressing this. So we have an agenda that's full. Left-hand side is neurology, right-hand side is oncology throughout the day. And I think our first neurology keynote panel will be a little bit later this morning with this group. And then we have an oncology keynote panel this afternoon. And so these are some of the questions that we would ask that you attempt to try to answer as part of this conference today. So with that, I would like to thank you for coming, and we're going to start the rest of the agenda. And I think this is a massive opportunity, so thank you very much.